Now, we do have a caller who'd like to speak to you. So, Barkha, welcome to Z Companion. Once again, Barkha, welcome to the show.
Thank you.
What's your question for Dr. Shah today?
I wanted to ask Dr. Shah, is psoriasis because of any food allergies or?
So, you said, did you say psoriasis?
Yes, you did.
I had two questions actually. Psoriasis, is it because of food allergies? And thyroid, does it happen because of gluten-free? Does it help if you go gluten-free?
Sure. So did you say psoriasis or lichen sclerosis? Sorry.
Psoriasis.
Psoriasis. Yes. So I explained briefly. Psoriasis, for those, is a skin condition often caused by itchy or inflamed or scaly skin. So as far as I'm aware, I do not know a specific food cause for psoriasis. This comes on, it's usually inherited, but it can come on later. However, from my clinical experience, I do know people who eat certain foods, it might flare up. And this can be a wide variety of foods. The classical allergens, which we'll come on to, particularly are wheat or dairy products particularly. Not that you're specifically allergic to them, but they seem to be, some of my patients, their psoriasis really flares up during this case. But there's no direct link to say that if you eat these foods, it causes this. So that's why, again,
So it doesn't cause it.
and you've mentioned the thyroid, which again we've covered in previous sessions with me. It's a gland which sits in the neck and controls our metabolism, over or underactive thyroid. Again, not that I'm aware of specific foods that would really trigger it off, apart from very foods rich in iodine or iodine-related water compounds. But really, I don't see a specific link between the two. And more importantly is to probably keep your blood levels of your thyroid hormone checked. So that would be my advice, generally making sure if you are you on thyroxine?
I am.
So basically, at least sort of our guidelines are once a year having a blood test done, checking that your levels are in balance. Of course, there are lots of other alternative treatments. Say that if you try this, maybe your thyroxine dose can go down. That I can't guarantee, but generally, as a GP, I'd be saying making sure that your thyroxine dose is normal. But I don't see a direct link, particularly between psoriasis and thyroid, and particularly allergies.
No, there's no link between these. Are for two different things.
Two different things, that's right, but no specific link with food or allergies. From my experience as a GP, obviously there'll be some theories out there, but from my everyday experience, I don't, and that should be fine.
Thank you.
Okay, Barkha, thank you very much for your call. उम्मीद है आपके सवाल का जवाब आपको मिल गया होगा. Dr. Shah, quick question. I'm coming back to Barkha, what she just asked. कि अगर किसी को thyroid issue है, are there any particular dietary things that you may suggest to your patients that this is good for you or this is bad for you, particularly if you're on medication?
Again, not specifically with thyroid. I mean, mainly just to know that it can be either overactive, in which case generally the metabolic rate is quite high. People are quite shaky. They lose weight, so they quite like that, losing weight, but lose excessive amount of weight. They can have thyroid eye disease, and an overactive thyroid is generally more dangerous. That can cause problems, and the treatment for it is a bit more complex as well. So again, seeing your GP, if you're concerned about certain symptoms, they can check your thyroid blood test. Once you've had it done once, generally it doesn't change. I have patients coming in every 6 months saying, has my thyroid changed? Please check it again. Generally, once it's been done once, maybe in a few years' time you could check it again, but checking it every few months if it was normal before.
Yeah.
Underactive thyroid is generally when you're putting on weight, more sluggish, more skin problems. And again, that's when we put you on this thyroid supplement called thyroxine.